Hello, this month we are observing the World Hair Transplant Repair Day. This is an activity by International Society of Hair Restoration Surgery, and at Venkat Centre we are observing this through a podcast, a video, and also a special activity to help these unfortunate patients. Hair transplantation has become extremely common, has become accepted and acceptable to most people. This is very nice, but at the same time, quackery has increased, black marketing has increased, and with that, more and more botched surgeries are coming up. And hence, this emphasis on repair of hair transplantation. I am Dr. Venkataram Mysore, initiating this podcast, and today I have with me my colleague Dr. Mihir Shankar, our plastic surgeon. So over the next 10-15 minutes, we will discuss this issue in detail.
Hello, Dr. Venkat. So, I wanted to discuss about this topic. So, what exactly is a botched hair transplant surgery?
Botched surgery you refer to when something goes wrong, a surgery which has gone wrong. And in the field of hair transplantation, that can mean usually something which has gone wrong in the recipient area.
Yes.
The recipient area doesn't look good.
Yes.
The density is less, some hairs have not grown, hairline is not proper, temporal hump is not proper, it looks unnatural, it looks artificial. All these are part of botched surgery. It can also refer to something which goes wrong in the donor area, too much of extraction, too scarring, necrosis.
Yes.
This also refers to botched surgery.
Yes.
Then there is one more serious botched surgery, and that is some serious complication happening. Recently, there was a report from Kerala that there was a serious infection of the scalp called necrotizing fasciitis. There were 2 deaths in Kanpur, which were done by 2 dental surgeons. Those are botched surgeries which unfortunately are extremely serious.
Yes.
So, botched surgeries usually affect the outcome without affecting life, but they can be serious enough to affect life also.
Even in the recent past, even I've heard a lot of cases from colleagues and friends. Is it because there are more people trying to get into this field who are unqualified, or is it only quacks? What is your opinion on that, sir? Why does this botched surgery happen?
See, till about 2007, 8, 9, we had only FUT, the strip technique. It was a difficult technique to learn and master. So, only qualified doctors, surgeons would enter the field. But then FUE became popular, particularly the machines got introduced. And that made extraction extremely simple. It made it simple for patients because healing would happen in a day. So patients loved it. At the same time, it made it simple for doctors and others to extract also. There was nothing serious happening. You were just making holes and pulling the hairs out. So, and it was under local anesthesia. It could be done in any minor theatre. That attracted not only qualified doctors to this field, which was good, but it attracted everybody else. Technicians were the first ones to get in. Initially, these technicians were nurses, operation theatre technicians. Later, it became anybody. For example, in the death which happened 3 years back in Delhi, there was not even a single medical or a paramedical worker in that place to do surgery. Still, they were doing it. And recently, we had 2 dental surgeons performing, and then that resulting in death. How are dental surgeons connected with hair? So, this has resulted, on the one hand, an explosion of market, and on the other hand, serious complications for the patients. This is the reason why we are observing this day, and there is so much focus on it.
I agree.
Quacks who are not qualified medically, not even a paramedical worker,
Yeah.
They are a BA fellow, a PUC fellow, a SSLC fellow, anybody coming and doing it, independently doing it, and without knowing the science of hair transplantation. That is what is responsible.
I think with also the need for, uh, I think with the youth being more conscious about how they want to look, the surgery of hair transplantation has become very popular in the past few years. So even that I think has attracted a lot of doctors to learn this skill and sometimes even do it without any formative training.
Absolutely.
Yeah.
One of the culprits here is actually social media.
Right.
Social media has been responsible for the popularity of this technique.
Yeah.
It has removed the fear of surgery from patient's mind, which is nice.
Yes.
But it seems to have removed that fear from everybody's mind.
Yes.
So anybody feels like doing it. There was one death in Chennai which was done in a spa. So that such things are happening. And then there are influencers who are not medically qualified speaking on this.
Yes.
And technicians speaking on YouTube, and a patient often doesn't know what is genuine, what is not genuine, who is qualified, who is not qualified,
Yeah.
and that leads to the such a complications. For example, then there is the lure of money.
Yes.
Some of these clinics will offer ridiculous discounts,
Yeah.
5 rupees per hair, 10 rupees per graft. For example, the one death which happened in Chennai a few years back, that unfortunate patient, he was a third year medical student. He went to a proper surgeon who quoted a particular price. Being a student, he didn't have the money. Then he went to this particular spa clinic where he went in. He got operated there, and that they said we will do it at some 25,000, 30,000, whatever. If you do it today, that was the condition.
Right.
This special price only for today. So he went into it. There was no proper antiseptic precautions, went home because he was in a hostel, and there he had septicemia. So all these factors together are contributing.
So then how do we treat these botched hair transplant surgeries, Dr. Venkat?
I will now come to the minor issues or aesthetic issues of botched surgery. Now, in the recipient area, botched surgery usually means one improper hairline. The hairline, as you can see here in this photograph, has to be a little zigzag. There have to be some irregularities.
Yes.
Nature is not perfect. Both sides look similar, but they are not the same. That's what makes nature look so beautiful. So, if you make it a straight line like this, without irregularities, or if you make it exactly same on both sides, it becomes artificial. This is one of the commonest mistakes. The second thing is, in order to make it look thicker, you use 2 hair units, 3 hair units in the front. Normally, the frontal hairs in this region are among the thinnest. Occipital hair is thicker. So, the donor area that we get is always thick. So, we have to choose the thinnest amongst those hairs to give a natural look. Instead, if you put emphasis only on the thickness and put 2-3 hair in the units in the front, that will look awful.
Yes.
Third thing is what is called the temporal hump. This hump here you can see in this photograph. Temporal hump is lost much later in life, but sometimes patient insist that I want this. So if you create it at a very young age, it looks bad. And sometimes people want a lower hairline. When we do hair transplantation, we are planning for the future. Today a patient may be 30, in 10 years he will be 40, in 20 years he will be 50. So we have to keep that in mind. So if you make him look 20 now, he will look extremely young and inappropriate when he looks much older. In addition to this, another issue that happens is pluggy appearance, or what we call cobblestoning. If the hair root is not placed deep enough, if it pops out a little bit, you get small little bubbles, as you can see in this photo. It is more common on the beard, and you can see here it in this photo. That looks very ugly. Then we have to do a laser to remove that extra tissue. Then of course the grafts may not grow. There may be a patch. And finally, if in some cases they put too much hairs in one small area, particularly in the center, if the patient is older and if he has diabetes and if he is a smoker, the entire skin can undergo necrosis and form an ulcer, as you can see here in this photo. So these are all the different reasons why something goes wrong in recipient area. Now we come to the donor area. Main thing that happens here is too much extraction. In the first sitting, not more than 25% should be extracted, which means if we have about 12 to 13,000 units here, maximum you can extract is about 3,000 to 3,250. But if we extract 5,000, that will look thin, as you can see in this photograph. It is looking so bad, already it is looking thin. So that is to be avoided. This happens because of greed. Because if you are charging per unit, then the more grafts you put, the more money the clinic gets. So where you can do with 2,000 grafts, you tell the patient, I will put 4,000 to you. And the patients are often misled. So these are the ways it can go botched. It can get botched in both donor area and recipient area.
I also feel a lot of celebrities and cricketers in the motive to look good are very aggressive in their or the surgeons treating them are very aggressive, and sometimes that can also botch their result. So now how do we go ahead and correct these botched cases? Is there a hope for them? How do we go about it?
There definitely is hope for them, and that is what is called a repair, hair transplant repair. And that is the focus of this hair transplant repair day, which is 11th November this year.
Okay.
Now the repair done is basically to normalize what has become abnormal.
Yes.
So if there are 2, 3, 4 hair units, you remove them. You don't waste them, you put them behind.
Okay.
You take out thin hairs and replace them. If it is too low, you remove those hairs and put them behind. If the density is less, you augment the density. And this is a painstaking process. Repairs take more time than a usual hair transplant. Also, it is generally said first transplant is the best transplant. So repair is a repair is a repair.
Yes.
Which means when you have done transplant in the first time, vascularity has got altered, the collagen tissue has got altered. So there has to be realistic expectations to what can be achieved. Often these patients, they become obsessed about their problems. They have placed a lot of hope on the first hair transplant. That got belied, they got disappointed. Now they want even better, more perfect result. So we have to tell them we'll make it better. But when the first thing has gone wrong and you didn't get perfection, don't expect it in the second session. So counseling, proper counseling is very important. I still remember there was a doctor's son who got a transplant done. This was about 7-8 years back. He had a straight hairline and he came for surgery. And he was so bitter, so unhappy, so frustrated that I told him, look here, I can do surgery tomorrow. I know what to do. I know that you need it. But I want you to wait. Get over this bitterness. Then I will do. Psychologically become a little bit better. Yes. Then the doctor called me from Patna. I think it was Patna. He called and said, I am very happy you said this to my son. I wish the first doctor had said this.
Yes.
So sometimes we have to hold the patient back from getting into surgery too frequently. Then cobblestoning, which I had shown the photo, I am showing it again here. There we use either a carbon dioxide laser or a simple radio frequency machine to destroy that extra tissue. It again takes time. It is a little painstaking process, but it can be done. Now in the donor area, if there is too much extraction and it is looking empty, we can do a procedure called scalp micropigmentation, wherein we place small dot-like tattoos. You can see here how we have avoided this scar in this picture into that, so that it looks darker and so it looks fuller. So these are the things which can be done to repair. Yes. Repair takes more time. So often what can be done in 4 hours will become 5 hours or 6 hours. Patient has to have realistic expectation.
What I infer from what you are saying is it's more difficult to correct what has gone wrong compared to doing it right the first time. So it's a cliched saying prevention is better than cure. So how do we now prevent such things from happening in the first place, Dr. Venkat?
This is a very important point you have made, Dr. Mihir. Uh, a repair should not be undertaken by a beginner surgeon. Some experience is needed as a primary case experience before somebody ventures into repairs. So this is something which one has to remember. And as far prevention is concerned, there are responsibilities on the part of the patient, there are responsibilities on the part of the center, and on the part of the operating surgeon. Patients have to be careful, thorough in their research. They should at least find out what is the qualification of the doctor. Now, after the death in Delhi, after hair transplantation, the High Court asked National Medical Council to lay down certain guidelines. Our association helped framing it, ISHRS guidelines. We have also published these guidelines, as you can see in this publication. And now you see the National Medical Council guidelines. These lay down who can do surgery, who should not do surgery. Generally, it is to be done by dermatologists and plastic surgeons with proper experience. That is very important to follow. So every patient has to know that it needs a trained dermatologist and a trained plastic surgeon for this. Don't go to anybody who puts a board. Technicians are not allowed to do surgery. Technicians can only assist a doctor. They cannot do anything independent. Dental surgeons cannot do a surgery. So these are very, very important. On the part of the center has to put in place all necessary protocols for taking care of the patients. The National Medical Council has laid down in detail there have to be facilities for resuscitation, there have to be a link up with a hospital if there is anything needed. So, for example, at Venkat Centre, we have facilities or all types of anesthesia. We get an anesthetist to be available in the theatre whenever there is necessary. We have defibrillators, we have ventilators, everything that is needed for resuscitation. That is very important. And then on the part of surgeon, the doctor concerned has to undergo proper training. Generally, it is said it takes about 100 cases before a surgeon can do a proper job independently. 100 cases meaning roughly about 6 months. Yes, there are some surgeons who can learn it faster, but generally about 6 months is necessary before somebody can think of doing a transplantation independently all by himself. So these guidelines have to be in place for before anybody does a transplantation. So patient has to be careful. He has to see what is the reputation of the center. For example, Venkat Centre has 2 dermatologists, 2 plastic surgeons who can do the surgery. And we have a team which has been performing hair transplantation since 2003. We have 4 theatres. We have a theatre with ventilator, defibrillator, and we always have an anesthetist on call. So these are the things that have to be in place.
Right. I think every individual has a responsibility of their own to make sure that a botched surgery doesn't happen. And I'm sure there is hope, even if a person has gotten a botched surgery where they need to go to trusted centers.
Yes. So as part of this activity, we are offering free consultation to anybody who has got a botched surgery, and they are welcome to come to Venkat Centre. Visit our website venkatcentre.com, follow us on the Instagram, and here are the details of the contact telephone numbers. You can contact us and we'll take care of you.
Thank you.
Thanks for Dr. Mihir for nice questions. Thank you very much.
Thank you.